again welcome all of you from wherever you are joined from Sri Lanka, Myanmar, Malaysia. So, guys, in today's session, in my session of around 30 minutes, I would be discussing about the types of contrast agents available, their mode of action, and I will also touch upon the clinical uses where they are indicated, and I also touch upon where to select which agent, so how to select the best appropriate agent. So let's start with imaging. What is imaging? It's just a simple technique and process which is used to create images of the various body parts. So that is medical imaging. So medical imaging can be performed by various techniques. It can be X-ray, it can be CT scan, it can be MRI. But let's start with X-ray. So X-rays are one of the most commonly used imaging techniques, very cheap. So what are X-rays? So it's just to tell you just very briefly about X-rays belong to the right-hand side of the electromagnetic spectrum. So they have very, very high energy, but their wavelength is short. So, and they, if not used properly, can also be damaging to the humans or the cells. So what is the basic principle how X-rays are produced? I will just go very briefly that X-rays are produced when a cathode releases its charge and it releases lots and lots of high intensity electrons. So when these high electrons released from the cathode, they reach the anode, they are deaccelerated. And when they are deaccelerated, X-rays are produced. So X-rays basically are produced by deacceleration of high velocity electrons. So in this process, what is happening? A lot of energy is also wasted in the form of heat, and the remaining part comes out of the tube as X-rays. So basic principles of X-rays, I think you are aware that X-rays, transparent tissues allows the X-rays to pass, so they appear black, and opaque tissues block them, so they appear white, and other tissues they appear gray. So that is generally how the X-rays appear. So now using the same technology or the same ray of X-rays, CT scans are also used. So CT scan, it is computerized tomography or computerized axial tomography. So it is also like an X-ray only, but you see what is happening. X-rays are produced, but they cut the human, whatever part you want to imagine or imaging. So you cut that part. The CT scan, there's a coil which rotates and it takes slices one by one of that body part. So that is how CT scan works. So it takes slices one by one of that body part. You can adjust the level of the slice. So advantages of CT scan, we know that it is more diagnostic accuracy as compared to X-rays, and they have really, I would say, helped a lot of disease to be diagnosed earlier and better as compared to X-rays. The major disadvantage of CT scan is that there is a radiation exposure, which meaning that, as I told you, these are radiations and these are powerful radiations. So if I tell you one CT scan, maybe of the head or neck, it is equal to 30 to 40 X-rays. And one CT scan of maybe the abdomen and the pelvis, it is equal to maybe 200, 250 X-rays. So a lot of radiation is involved in CT scans. And another part is limited soft tissue contrast. So for that, you need to have MRI. Now, coming to the main part which I wanted to discuss with all of you is the contrast medium. So what is contrast media? So it's a radiographic agent which is used to enhance the sharpness and visualization in imaging. So what it does basically, X-ray or CT scan gives you images, but to increase the contrast of the different body parts which you want to highlight, the contrast agents, they increase the contrast, and this gives you better visualization. So contrast media, just a brief slide on contrast media history. So first contrast media was sodium iodide, introduced in 1920s. After that, in 1960s, it was being iodine was being bound to benzoic acid derivatives. So we used to have triiodinated benzoic acid derivatives. And in 1970s was the discovery of low osmolar contrast media like iohexol, iopamidol. And in 1980s, 1990s, there was development of non-ionic isotonic dimers, so which we will discuss in the coming. So which media or which kind of contrast media to use when? So generally for X-rays and CT scan, iodinated contrast medias are used. They can be ionic, they can be non-ionic. For MRI, generally gadolinium-based contrast medias are used. For ultrasound, microbubble-based contrast media are used. And nowadays, even in nuclear medicine, like PET scan, positron emission tomography, they use radio tracers like FDG, fluorodeoxyglucose. So contrast media differs upon the type of imaging a doctor wishes to choose. And accordingly, that contrast media should be used. So contrast media, if I classify, they can be classified into two types, negative and positive. Things like which were negative contrast like air, and something like positive contrast, which they give you more illumination or they emit something. So that gives a positive contrast, like iodine compounds, barium compounds. So we will discuss more on the iodine compounds. Now coming to a very important question, like what is the ideal contrast media? So this is very important. So why are we using the contrast? We are using it for opacification. So it should have maximum opacification, so which can give you the best quality image. Second point, it should be easy to excrete. Why? Because the longer the contrast media stays in the body, the more are the chances of any adverse reaction to it. So all these contrast media, especially the recently developed, they are very hydrophilic. Hydrophilic means they are very much soluble in water. So when a chemical is more soluble in water, it is easily excreted by the urine. It should be less lipophilic. It should not be more soluble in lipids. Otherwise, it will go in different body cells, different body parts, and it will not come out. It will remain in the body part for long and can cause reactions. So remember, it should be more hydrophilic, less lipophilic, and it should also have low viscosity. What is viscosity? Viscosity is like the amount of particles present in a solution. As compared to the iodine particles. So if the viscosity is less, the chances of reactions are also less. Though low osmolality, which I just discussed, low protein binding, again, the higher the protein binding, the more it stays in the body. It is more tightly bound to proteins, then it doesn't come out. So it should have low protein binding and minimal drug interactions. So the newer agents you see, they have all these properties. They are more hydrophilic, less lipophilic, and they have low protein binding. So how to choose a contrast agent? So as I told you, it depends your organ of interest. You want to check brain, use MRI. If you want to see lungs, use CT. So we will see in detail also renal functions. Some contrast cannot be used in renal functions. Some dose should be reduced. History of allergies. So patients having some allergies, then the non-ionic contrast should be avoided. So if you go in detail, just a slide. So it depends. As I told you, imaging modality. CT X-rays, you use iodinated contrast. For MRI, gadolinium based. Now I was discussing about the target anatomy. Suppose which part of the body you want to see. So if you want to see brain and spine, MRI with gadolinium is the best. If you want to see the lungs and vessels, CT angiography with iodinated contrast is the best. If you want to see liver, then again, either do an MRI or contrast and ultrasound. So the thing is, depending upon the target anatomy, the doctor chooses which imaging needs to be done, and accordingly, the contrast is chosen. Again, if GFR is more than 30, you can use any contrast. But if it is less than 30, then there are certain contrasts like non-ionic dimers. They should be preferred. We will discuss in detail. Very important, history of allergy. If the patient earlier has a history of allergy to contrast, they should be dealt very cautiously. Pregnancy. Avoid all contrast unless essential. So it should be only used if the benefit is more than risk. So this is how it tells you how to choose a contrast agent. Now, a very, very basic thing I just thought I should discuss with you. Why iodine is used in contrast agents. Because in the coming slides, I will discuss about iodinated contrast agents. So all of you may be aware also, but just to revise you, iodine is an element having very high atomic number. So what happens when it has very good properties of absorbing X-rays and also emitting. So it leads to increased absorption of the X-rays, and this helps in contrast enhancement. Second part is that it is excellent water soluble. I discussed with you ideal contrast agent should be water soluble. Iodine is water soluble, helps in easy excretion and also rapid excretion. So that is why iodine in contrast agent is one of the most preferred element. So if you talk about contrast media, we will discuss in two ways. One on the basis of their osmolality, and second based on the ionicity. So first, on the basis of osmolality, contrast media can be classified as high osmolar, low osmolar, isoosmolar. On the basis of ionicity, they can be classified as ionic, non-ionic. So I will go in detail and we will discuss these parts. So ionic, non-ionic. So what are ionic? They're ionic in nature. When they are put in water, they forms ions, cations and anions. They have very high osmolarity, and that is why more side effects. Less commonly used nowadays. Non-ionic contrast media, as the name indicates, they don't dissociate into ions. So the osmolarity is low and the safety is high, like iopamidol, iohexol, iodexanol, very commonly used contrast agents. So just basic properties which I discussed with you, that ionic agents dissociate into ions, a positive charge and a negative charge. Non-ionic agents do not dissociate, and their osmolarity is therefore low. So ionic contrast agents are salts like ditriazolate and iothalamate. So each salt molecules form two independently moving particles. The iodinated part bears the negative charge. The contrastless cation has a positive charge, usually sodium or meglumine. So these are of two types: ionic monomers and ionic dimers. So as I told you, ionic monomers, since they have a high osmolality, they are not uh, they dissociate into positive and negative, and their iodine to particle ratio is 3:2 in solution. Meaning, so there are three particles of iodine and two cation and anion. So their osmolality is very, very high. So that is why more side effects. Ionic dimers, their osmolality is comparatively low, around 800 milliosmoles per kilogram. And that is why their side effects are comparatively lower. Their iodine to particle size ratio is 6:2. Now, as I told you about the ionic ones, now coming to the so ionic ones, just the few names which we have Tazograph, we have Leggraph. So these are the few iodinated contrast media which we have. Now coming to non-ionic contrast medias. So as I told you, the non-ionic ones, they do not dissociate, and therefore they do not have any electrical charge. So here the triiodinated benzene ring is made water soluble by the addition of hydrophilic hydroxyl groups, which I will just show you. They have comparatively low osmolality. So again, these are also two types: non-ionic monomers and non-ionic dimers. So if you see that in non-ionic monomers, here you can see, if you see the figure, this is the benzene ring. This is the three iodine molecules. So here, iodine to particle ratio is 3:1. And that is why they have low osmolarity as compared to the ionic ones. Example, contrapaque, pamidol, very, very commonly used contrast agents. Then there is non-ionic dimers. So here what happens? The two monomers join together and form a dimer. So here, if you see in the figure, there are 6 iodine, 1, 2, 3, 4, 5, 6, and one particle. So their osmolality is even lower, less side effects, and because less discomfort on injection. Example, iodexinol or Cardiolec. So as we were discussing about non-ionic contrast agents, iopamidol, iohexol, iodexinol, the brand names Pamidol, Contrapac, Cardiolec. So Pamidol and Contrapac are non-ionic monomers, and Cardiolec is non-ionic dimer. Osmolality, as I told you, the monomers have high osmolality as compared to the dimers. So I think this I have touched earlier also, but just to add some part to it, like as I told you, non-ionic ones are the very commonly preferred ones. Why? Because there is no carboxyl group. As the carboxyl group we remove, there is less chance of neurotoxicity. Eliminating ions decreases osmolarity, and adding hydroxyl group decreases chemotoxicity. Sorry. So because of all these factors, non-ionic contrast media are one of the very commonly used in today's clinical diagnostic imaging. So if you see, if I just compare you the three, the Pamidol, Contrapec, Cardiolec. So we discussed that Pamidol is iopamidol. It's a non-ionic monomer. Osmolarity is around 616. Iodine concentration around 200, 370 milligram per ml. And excretion is unchanged of all three. Nephrotoxicity is low. Iohexol, it's also monomer. Now coming to iodixinol, it's a non-ionic dimer. Its osmolarity is even lower than the monomer. It is 290, almost that of the human blood. And it has, if you compare the among these three, iopamidol, iohexol, iodixinol, the best renal profile is of iodixinol. So this I was just wanted to touch this also, but which contrast media we can prefer in renal impairment. Renal impairment, as I say, renal impairment, it means that when the eGFR is less than 30 ml per minute. So in that cases, iopamidol, iohexol, both can be used, but they should be used with caution. Iodexinol, if you have to prefer out of these three, iodexinol can be better and can be preferred in patients whose eGFR is less than 30 because of the low osmolality. So indications for Pamidol, it can be used for arteriography, phlebography, urography, myelography, digital subtraction angiography. For Contrapec, it is preferred for all kinds of arteriography, angiography, aortography, peripheral angiography, urography, myelography. Cardiolec, as I discussed, it can also be used for all kinds of angiographies. And as I was discussing, it can be a preferred agent. It is also preferred for myelography. It is also a preferred agent in patients having kidney dysfunction. Very briefly touching about the benefits, Pamidol, it's again very well documented and one of the most commonly used radio contrast media worldwide, very well tolerated and has good compliance, good safety profile for renal failure patients, do not disturb hemodynamics, safe. Contrapec, if I come to, it has low cardiotoxicity, has Contrapec is a safe option for patients, for cardiac patients who are planning angiography, less neurotoxic, safe for even for myelography, safe and well tolerated. And very importantly, does not disturb coagulation, hence is ideal for patients having abnormal bleeding tendencies or coagulopathies. Cardiolec, again, provides very good imaging in patients with all kinds of coronary angiographies, shows favorable fibrinolytic properties. And as I was discussing with you, it has a very less risk of contrast-induced nephropathy.